माध्यम से स्वास्थ्य और मन की शांति पर काम किया जाता है। यह संस्था ध्वनि और संगीत की शक्ति को समग्र स्वास्थ्य से जोड़ने का प्रयास करती है और डॉक्टर इंद्रायणी जोशी द्वारा स्थापित यह केंद्र भावनात्मक संतुलन, मानसिक स्पष्टता और आंतरिक शांति पाने के लिए लोगों की सहायता करता है। कैवल्यनाथ वेलनेस फाउंडेशन में प्राची मुळे मार्केटिंग एग्जीक्यूटिव और डॉक्टर प्रशांत पवार चीफ ऑपरेटिंग ऑफिसर का दायित्व संभाल रहे हैं। यहाँ संगीत चिकित्सा को सरल, वैज्ञानिक और कलात्मक तरीके से अपनाया जाता है ताकि व्यक्ति का संपूर्ण कल्याण हो सके। हाल ही में इस संस्था में सभी के लिए सदस्यता अभियान शुरू किया है। जो भी व्यक्ति इस संस्था का सदस्य बनना चाहता है वह डॉक्टर इंद्रायणी मैडम को उससे संपर्क कर सकता है। यह थी बड़ी छोटी सी जानकारी इस संस्था के बारे में। और संगीत की महिमा को तो हम जानते ही है। संगीत जो है परमात्मा से हमें कहते हैं जो भी संगीत सीखता है या संगीत का जानकार है वह उसे मोक्ष पाने के लिए या मुक्ति पाने के लिए कोई और प्रयास करने की जरूरत ही नहीं है। अगर हम संगीत साधना कर लेते हैं तो मोक्ष की प्राप्ति अनायास हो जाती है। और इससे ज्यादा मैं क्या ही कहूँ, इंसान का हर प्रयास तो बस इस बंधन से मुक्त होने का ही होता है। तो आइए इस आज के इस अभियान में या आज के इस व्याख्यान के कार्यक्रम में हम हमारे जो व्याख्याता है या हमारे चीफ गेस्ट है, विशेष अतिथि, उनके बारे में उनका अल्प परिचय पाने के लिए मैं आपके समक्ष बुला रही हूँ डॉक्टर इंद्रायणी मैम को। वो इस विशेष व्यक्ति का आपसे अल्प परिचय करा देंगी और आज का प्रोग्राम हम शुरू कर सकते हैं। धन्यवाद।
Namaste and thank you very much, Indrayani and team, for this invitation. And I'm very glad to be amidst all of you. I think some of you I'm already familiar with, some of you are new. It's nice to be making new friends as well. And just now, Mrinalini ji said that Sangeet के मार्गम से मोक्ष मिल सकता है. She conveyed it as a possibility. मैं तो बोलूंगी कि मोक्ष का एक ही मार्गम है, वो संगीत है. क्योंकि इसीलिए हम लोग काशी को मोक्ष नगरी बोलते हैं. That Kashi is the place which never sleeps. It's the land of eternal sound. वहां नाद हमेशा रहता है, इसीलिए काशी को मोक्ष नगरी बोलते हैं. That is the reason. And सदगुरु त्यागराज स्वामी ने अपने गीत में बताया है, संगीत ज्ञान विहीनुलुकु मोक्षमु गलदा, which means the one who doesn't have knowledge of music will not get मोक्ष. तो कौन सा वो मार्ग हो सकता है जिससे हमको मोक्ष की प्राप्ति हो सकती है? सिर्फ एक ही मार्ग हो सकता है, वो है संगीत. बिकॉज इसमें क्या है, सब कुछ एक ही चीज में अगर सब कुछ आता है, भक्ति भाव आता है, उसमें इतना नॉलेज आता है, स्किल आता है, स्वर देवता का हम उसमें से हम इन्वोक करते हैं स्वर देवताओं को. एवरीथिंग कम्स इन, इट्स अ वन पैकेज, सिंगल पैकेज. वी डू नॉट हैव टू गो to very different I mean घर मंदिर बन जाएगा अगर संगीत होगा तो. You don't really have to go to the mandir and search for God. It is in the house. But then yes, today we are going to talk about the clinical applications of music therapy, how we use it in clinical practice. And yes, whatever we said right now is from the scriptures, from the various sources, but we have to look at it from evidence informed ways how to do it. And so we will be looking at it from the scientific point of view. So before we begin, I would like you all to just close your eyes for a few seconds. So just tell me, what changed in you? Did your breathing change? Hardly 45 to 50 seconds, hardly 40 seconds. Did your breathing change? You can give a thumbs up or a thumbs down. Did your shoulders just drop? Did your mind slow down? So how much time did it take to bring about this small change? Hardly 30 to 40 seconds. And did it require anything very complex? All that it required was a stable, continuous sound which did not have any urgency, which did not have any alarm, which did not have any demand. It was just the presence of the sound. And you noticed that subtle shift in your state of mind, subtle shift in the state of your breathing. Your shoulders dropped. Suddenly you became calm. Right? And this subtle shift is where what we call clinical music therapy or music therapy begins in the hospital settings where people are sick. So let's take a minute. Let me just give me a minute to share my slides. So is my slide seen? So today we will be talking about music therapy in clinical practice, how music can be used to enhance recovery, comfort, and connection when we have a person who's even a small ailment, getting into even a small cold changes your life. Getting admitted to the hospital is a big change. So we look at how this can be done. We will explore uh, how music therapy can be done in clinical practice. Now, in the hospital, I hope my slides are changed. So, in the hospital, music is not entertainment. It is not just about just like background ambience which is given in the mall or in the hotels. It is not just devotional expression. It is structured, it is goal oriented, and it is guided by assessment and reasoning. So, what you're seeing is the campus where I work. Within the hospital walls, music is a silent medicine. It is not an injection, it is not a drug which is going in those lines, it is not a tablet or it's not a capsule, but it is a non pharmacological analgesic that soothes pain, steadies the mind, and speaks to the soul where drugs cannot reach. So, today, what we will do is explore the neurobiology of music in clinical settings and how we can assess and plan music therapy interventions. Also, we will look at Indian music therapy techniques and their clinical interventions, their logic. And of course, I will be sharing a few real world hospital case studies which we have dealt with at our hospital and how we can integrate music therapy in multidisciplinary care is what we will look at. And of course, Indrayani had already asked me to speak a bit on Rag Chikitsa. I will talk a little bit on Raga Chikitsa also, a little bit, and I'll tell you how it works. So, to begin with, beat perception is innate. We all respond to rhythms very early. It is said that a baby in the womb of a mother responds to rhythms. So, uh, a fetus is able to detect predictable repeated sound pattern. Babies, infants are able to detect sound patterns. And what happens is the basal ganglia in the brain extract the beats and predict the rhythmic continuation. What we hear gets in the ear, goes to the auditory cortex of the brain, and it gets transformed, transmitted to the motor cortex, and that enables synchronization of movement and comfort of movement. There is also a linkage with the reward systems. We will discuss about it, which is the mesolimbic dopaminergic pathway, which gives us a sense of pleasure when we dance or when we engage with music. So, just to reiterate, beat perception is innate and we naturally respond to rhythm by either swaying our body or nodding our head. And even if there is no motor movement, there is something called as a change which happens in the heart rate. Something just happens with the blood flow within the body in response to the rhythm. Now, what is done in hospitals? In hospitals, music is therapy is an evidence-based use of music for therapeutic goals, and we can use it across the medical specialties, the surgical specialties, and also the mental health specialties. Music therapy has to be tailored to the patient needs within the multidisciplinary care that we give to the hospitals, and it is usually done that way. What music therapy is not, I have already talked. It is not background entertainment. It is not passive ambient music, and it is not about raga prescription for a particular disease. So there is no rigid raga disease prescription. We cannot say that this raga will work for this disease and give it like a prescription, like how we give an antibiotic for a sore throat. And it is not a musical performance. What we do in the hospital or in clinical settings or when in therapeutic settings is not performance centered activity. Now, why we need to use music therapy in the hospital? Music therapy has the ability to address physical, psychological, and social well being, and of course, the emotional well being. And it is complementary to all the pharmacological treatments that we give, whichever field of uh, medicine that the person chooses, whether it could be allopathy, that is modern medicine, Ayurveda, homeopathy, whatever, it is an adjunct to all the pharmacological treatments that we give. And music itself, it has a calming presence, so it humanizes the hospital environment. And music therapy is very flexible. We can adapt the music. When you give a pill, when we give a particular tablet or a syrup, the patient will say the tablet is bitter. The child will say, I cannot drink this syrup, it is bitter. And the patient will say, Itna bada goli hai, I'm not able to swallow. So can we change the size of the tablet or the taste of the tablet or the color of the tablet? It's not possible. It is only the molecule that can change to suit the particular disease that we are treating. But music can be adapted to a person's preference, the personal preference and the cultural background from which the person is coming, irrespective of whether he or she has any prior training in music or not. So that is what makes music a unique form of therapy in the clinical settings. Now let us look at the neurobiology of music. Can somebody tell me what this picture means? What are you seeing there?
Ma'am, might it tells about
Plain. How music enters through ears and reaches the brain. How
ma'am,
music enters through the ears and reaches the brain. Yes. You're right. Anything else? Yes.
ma'am, how we perceive and our left and right hemisphere uh, catches and manipulates according to the music and where it goes up
So,
like that.
music is a right brain activity or a left brain activity?
Ma'am, it's right.
Really? So, you're not using your left brain when we use.
Mm.
Ma'am, I think
Ma'am,
both
because
just because
creativity is related to right brain, so I thought.
So, if I'm
ma'am, I
not if
think
I'm
both
not creating music, I'm not A.R. Rahman. I'm not writing lyrics. I'm not writing lyrics. I'm not doing a ragala, but I'm just singing what somebody else has sung. So, which part of the brain I'm using?
Ma'am, now I'm thinking like both brain are involved because language processing and everything like lyrics, if we are
Yes.
processing lyrics, so it will be left brain.
Yes. Somebody else has something else to say? Okay, but this picture, yes, you will have to unmute and speak because I can't see you. All the neural activity, the symphony of neural activity begins with a vibration at the ear level, like somebody pointed out. Music enters through the ear, but it is the brain which transforms the sound or the vibration into emotion into movement, into a meaningful experience. So it all starts in the ear, but brain is where the sound gets converted into a signal, and the signal becomes an experience that we have. So let's look at the neurobiology of music. I think all of us are familiar, uh, and we have heard it multiple times. Music is one of the it's the only stimulus that can simultaneously activate every part of the brain. So it can simultaneously activate the maybe different components or different elements of music, but it can in one go activate the auditory cortex, the limbic system, the prefrontal cortex, the basal ganglia, cerebellum, and the brainstem autonomic centers. So whenever we listen to music, multiple areas of the cerebral cortex are activated. That is the auditory cortex, the frontal areas, whatever I said just now. And what happens is there is an increase in the neuronal activity. Now, the increased activity also causes an increase in the blood flow. So, the vessels in the nervous system, there is an increase in the cerebral blood flow, is what we call it. So, this is called as neurovascular coupling. So, there is increase in neuronal activity. There is also increase in the blood flow. And this has been seen in functional neuroimaging studies such as the functional MRI. So there is change in the perfusion which is induced by uh, music. And then there is also activation of the mesolimbic dopaminergic pathway that we talked of. So what happens is music will activate the ventrotegmental area in the brain, and dopamine gets released in the nucleus accumbens area. So what once dopamine is released, there is engagement of the striatum, which supports the rhythm and the motor entrainment. And the hippocampal area of the brain links the music with the memories that we have. And the amygdala part of the brain modulates the emotions, and that is why we experience the goosebumps moment to some music. There is also emotional regulation that happens. Just a simple omkar that you heard for 30 seconds made you feel calm, right? And you can also have memory recall. So autobiographical memory can happen when in people who have dementia particularly, it is very, very useful. The rhythm in the music can cause motor entrainment, like what we see, and that is what we employ in Parkinson's and other neurodegenerative uh, conditions for the gait rehabilitation. Now, what happens when there is an increased activity in the brain? As I said, there is neurovascular coupling, and so there is decreased blood flow. Now, once this happens, we said there is activation of the ventral tegmental area, the nucleus accumbens, the striatum, the hippocampus, and the amygdala. So, when this happens, dopamine is released in the nucleus accumbens area, and there is also activation of the hypothalamo pituitary adrenal axis. So because of this, what happens is there is change in the heart rate, there is modulation of the blood pressure, and there is entrainment of the respiratory rhythm. So the breath also becomes either calmer, or if the beat is high, it also increases. There is also change in the vagal tone. So when we give slow structured music, there is increase in parasympathetic activity and decrease in the sympathetic tone. And this is very relevant because when we use music for treatment of anxiety, for pain, or for stress, the autonomic regulation is very, very important. So when we give calming, predictable music, which gives you that safe, secure space. It reduces the activation of the CRH, corticotropin releasing hormone, and it reduces the release of adrenocorticotropic hormone, reduces the release of the stress hormone from the adrenal cortex, which is the cortisol. So this is the biological basis for stress reduction, and once stress is reduced, immunity is improved. So, and there is also reduced inflammatory load and emotional stabilization. So let us look at the uh, pain modulation mechanism. Can music be used for treatment of pain? Yes, ma'am.
Yes.
So
Yes,
how
yes,
will,
ma'am.
any idea how that works? What is this gate control theory? Anybody knows? Anybody knows what is this gate control theory? Now, what this gate control theory states is pain signals, whenever we have an injury, pain signals travel from the injured area to the spinal cord and then to the brain. In the spinal cord, there is a gate. Okay? So, this gate can either allow the pain signals to pass through, or it can close and reduce the, it can partly close or completely close, and the signals will not pass through. Now, what music can do is it can activate other sensory pathways, and because of that, the brain's attention is engaged, emotions and the relaxation responses are also engaged. So, the stimulation of the alternate sensory pathways, what it does is it partially closes the gate, and so there is reduction in the intensity of the pain signals that reach the brain, and that's why pain perception reduces. So, to keep it simple, music competes with the pain signals and helps the brain to perceive less pain. What else it can do? It also releases endorphins. Endorphins are the um, you know uh, it's a hormone which is uh, reduces the substance T, and therefore we get that pain relief experience. So it also can divert your attention from the pain, and also emotional reframing, the response to pain. Why am I experiencing so much pain? Why me? Why am I suffering? That reframing can happen with music. So that is, pain is not purely nociceptive, right? It's not just about the experience of somebody poking you or an injury. It is, pain is also cognitive and emotional, and music can influence not just what we call as nociceptive. It can also influence the cognition and the emotional response to pain, and that's how it works, right? Modulating pain, and that's how music can be used in pain management. I already said that rhythm perception is innate. Beat perception is innate. We all are born with innate beat perception. Rhythm can directly engage the basal ganglia, the cerebellum, which is responsible for coordination of movement. We know that when we keep the right step, we need to swing our arm, left arm, and we know exactly how big the step has to be or how small it has to be. We don't keep big long steps and end up having faults. So that is all brought about by the cerebellum. Coordination in the speech, how fast or how slow you speak and how the clarity of the words, that's also brought about. Although the motor speech area is the primary thing, it is the cerebellum that is responsible for the coordination, and the motor cortex is responsible for the movements. Now, the rhythm engages the basal ganglia, cerebellum, and the motor cortex, and that's how rhythmic auditory stimulation works in Parkinson's disease and other neurodegenerative conditions, and also in stroke rehabilitation. Now, music can activate autobiographical memory. Suppose I hear a particular song which is from the days of my school, then I'm taken back to my school days, which is more than 40 years ago, right? So music can bypass the damage, even if I have had damage to the cognitive pathways, like how in old age or in dementia or in Alzheimer's, music can bypass the damaged cognitive pathways and activate the autobiographical memory. So this is why a dementia patient may not recognize his family, may forget his own name, but he can sing a childhood bhajan very fluently. So, in principle, in clinical practice, we choose the musical element based on the neurological goal. So, for dementia patient, we will use the familiar songs to create the reminiscence. So, in the hospital, music can be used for symptom management, like how we said, to manage pain, for anxiety, for breathlessness, for nausea, or for insomnia. It can be used for rehabilitation, which could be a neurological rehabilitation, for vestibular rehabilitation, for cognitive rehabilitation, or for speech rehabilitation, voice therapy. It can be used as emotional support for coping with diagnosis. Suppose I tell somebody that you are diagnosed to have tuberculosis or you are diagnosed to have cancer. That shock of having an illness itself is difficult. So we can use music to, when we break the news, so that the person gets supported emotionally and can cope with the diagnosis, can cope with grief, can cope with uncertainty. You don't know how long this illness is going to be prolonging, how long your one is going to suffer. So there is an uncertainty with any illness. For procedural support during surgeries, during chemotherapy, or during physiotherapy, you can use music. Also, we can use music especially in the ICU, in the palliative care situations, and in the geriatric wards to enhance communication between the patient, the family members of the person who is suffering, and the staff in the intensive care setting. So, a lot of evidence is there for music therapy in the literature, which is covering where music therapy is used in oncology, perioperative care, in the intensive care setting, the pediatrics, in neurology, and in psychiatry. There are systematic reviews and randomized control trials which highlight the therapeutic benefits of music in pain, in reduction of anxiety, and improvements of quality of life. Indian studies have, there are Indian studies, but there are limited Indian studies which have contributed to culturally relevant evidence, and there is need for more Indian studies. Now, I'm just summarizing the literature. There are Cochrane reviews where music therapy has been used to reduce anxiety, pain, and depression in cancer patients. There are randomized control trials done in pediatric patients which have shown that music can reduce the pain and distress during procedures. When we wheel children for surgeries like tonsillectomy to the OT from the preoperative room, that is the point when they are separated from the parents and they are taken away. If the nurse sings familiar rhymes and plays with them and takes them along, the crying is much lesser. They happily come to the OT. And sometimes we keep them engaged in music till they are sedated and anesthesia is given. So that is how we reduce their anxiety, and that separation anxiety, which is there from having been separated from the parents and brought to an alien environment, that fear also reduces. In the perioperative period, it can reduce anxiety, not just anxiety, but also the dose of the pain drug that we use. In the neurological settings, rhythmic auditory stimulation improves gait, for especially in stroke, when we use it for stroke rehabilitation in the paraplegics or hemiplegics. In systematic reviews have shown that the use of music in the intensive care unit reduces the need for sedation and patients sleep better. Now, looking at the Indian studies, people have used in there are randomized control trials where Vedic chants and Indian classical music has been used to reduce anxiety while performing gastrointestinal endoscopy. Passive listening to Indian ragas has shown lowered blood pressure and heart rate variability changes. Of course, they are pilot studies only. There are no large scale studies. There are also emerging trials in oncology settings with classical music saying that even in the cancer settings, music has reduced anxiety and depression. A systematic review conducted in 2024 showed that Indian classical music improved quality of life and reduced depression in the elderly population, the geriatric population. So this is about the summary of the selected studies, just which I just summarized to you all. I'm not going to again repeat. So how we do music therapy? Before any intervention, we have to assess. So what do we assess? The first thing we need to make sure is of the diagnosis and whether the patient is stable enough for giving music therapy. In an unstable patient, you should not give music therapy. Then we assess the cognitive status, the emotional status, the music preference of the client. If the client is not in a position to give the music preference, we ask the patient's family or the caregivers and find out what would have been their previous musical experience. We try to understand their cultural background, their also musical background, whether they have been trained in music or whether they had an interest in music. What about their linguistic background? There will be patients who are multilinguistic, who listen to Hindi film songs as much as Western music. They will also listen to Kannada or Tamil or Bengali or whatever. So we have to ascertain their linguistic background and also their sensory tolerance. What level of volume they can tolerate, and whether they are able to tolerate, fast tempos. What happens to them? So we need to give small clips and check what are the changes and find out how much they are able to tolerate. And then we need to check. We need to ascertain what are the therapeutic goals. How do we ascertain the therapeutic goals? Based on the assessment that we have done, the medical diagnosis, and in discussion with the treating team of doctors and the patient's family, if the patient is not in a position to tell you what his or her goals are. But it's always good if you are able to involve the patient also and write up the therapeutic goals. Now we need to remember here, it's not about what shall I sing today for the patient. When you are treating a patient, you don't ask the patient or the patient's family, what shall I sing for you today or what music shall I play for you? We need to ask ourselves, what is the therapeutic goal? What is the objective that I need to achieve today, try for this patient today, which will determine what kind of music you would be using for the patient. Now, when we set goals, we need to ensure that the goals are specific, they are measurable, they are achievable, they are realistic, and they are time bound. So let me give a few examples of goals, how we set goals. Suppose it is a patient who has anxiety and we want to reduce the anxiety symptom. So we need to write a goal which is for reducing the symptom. So it could be reducing the anxiety score, which was 9 on a scale of 10, to 5 during chemotherapy. The person is receiving chemotherapy, so very anxious, so we want to reduce the anxiety score. Now, whether if we are dealing with a person with motor issues, like we are rehabilitating somebody with Parkinson's disease or with following stroke, the goal will be to improve the gait cadence, that is the rhythmicity of the gait, by 10% in 4 weeks. Right? So it is time bound and it is, whether it is realistic, it is measurable, and it is probably achievable. We still cannot say, because here I am talking about its imaginary goal, but it is definitely realistic, because having had the experience, I can say it is definitely achievable. Sometimes, yes, patient's condition may deteriorate, which is probably because of the disease per se, but it is definitely achievable, definitely realistic. The next thing, when we look at a communication enhancement goal, somebody is having aphasia, or a child who is having speech difficulties. So, increase the spontaneous verbal output from 1 word to 3 word phrases. So, the person is probably saying only monosyllable ah, or yes, no kind of words. You want to increase it to a 3 word phrase, such as I am Ram, or my name is so and so. I want food. I am thirsty. So increase the spontaneous verbal output from 1 word to 3 words in 4 weeks. So that is how we need to write goals. So once we have established the indication for music therapy and written the goals, we should also know when we should not intervene as using music therapy. When a person is delirious, when a person is severely agitated, head injury patients will have delirium, will have agitation. If the person is also having psychiatric conditions where they are suicidal or homicidal, you can have, negative response to music therapy. The person may end up committing suicide rather than, music helping in preventing suicide. So in such situations, probably we should not intervene unless and until we have the treating psychiatrist by our side to manage the suicidal tendency even after the therapy session, not just during the session, even after the music therapy session, it can happen. A person who is having unstable hemodynamics, whose saturation is just 50%, or oxygen saturation is just 40% or 50%, pulse is very low, BP is very low, it is just dropping. In such situations, we should not, because that is the time when CPR has to be done. We should leave the treating team to do cardiopulmonary resuscitation. That is not the time for music. Sensory overload states we should not do. So it's not doing music therapy in such situations is about clinical humility. It is about understanding that here, this is not the place where I can work. Let me leave it to the people who are better qualified than me. You can't say I will do in such a situation. Now, let us look at the various music therapy techniques that we can use. I'm not talking about all the techniques. There are several techniques. I'm giving you only a list. And as a music therapist, one who has to be very intuitive and one has to always be creative to adapt to the needs of the client, adapt to the music preference of the client. One is music listening, which we also call as receptive therapy. Music therapy, where we do passive listening to live or recorded music for relaxation or for stimulation. Live music performance, where the therapist or a musician, a volunteer, performs at the bedside, right? somebody who's trained in music or somebody who can play an instrument or sing performs at the best side. Next thing is active therapy, or where the first thing is that is active music making, where the patient participates, joins us while singing. It could be just humming, or it could be just body movement or swaying. It could be clapping, tapping, any form of body percussion. It could be playing a simple instrument like a kartal, or the client may also improvise along with you. The next thing is the guided imagery with music, where we take them to a happy place, to a place of calm, a place of beauty. So, through the music combined with relaxation, with breathing, with imagery exercise. The next is discussion of lyrics or analysis of lyrics. So, the person will explore the song lyrics for emotional processing. So, we can, if we want to take the client to a happy place, we can explore lyrics like चल के तुझे मैं लेके चलूं एक ऐसे गगन के तले जहाँ गम भी न हो आंसू भी न हो बस प्यार के प्यार पले. So what happens is the person feels more connected, feels compassion, feels love, feels he's going towards a happy place. You can discuss these lyrics and you can also understand what the person is going through in his or her mind. You can also ask the client to write lyrics, so songwriting and composition, to process their own emotions or express their emotions. That is also a music therapy technique. You will see people who have never had any previous creative writing instincts. They become poets. They write so beautifully at that point of time. The illness probably changes a lot of things. Now, we can either do music therapy, most of the time, we do a combination of individual one-on-one as well as group music therapy. But there are many situations when only one-on-one works. Group music therapy needs a similar cohort of people. Group-based activities help social engagement and support. And when you have a cohort of people with similar problems, group music therapy is very good because that cohesion, that group synchrony is very energizing and it is very, very therapeutic. Now we were talking about raga therapy, and Dr. Indrayani Joshi also wanted me to talk a little about how ragas can be used. So, Indian music definitely offers structured frameworks, Indian classical music. So, the raga, tala, the drone, the tanpura drone itself has a framework. The swara system that we have can also be used. So, these all have a certain predictability. The raga gives a melodic structure, and because of that, it has a that predictable contour, melodic contour of the raga can evoke a particular emotion that we call as rasa. For example, Ahir Bhairav can be calming. It can make somebody introspect. Yaman is supposed to be emotionally stabilizing and improving focus. Desh Rag can be very uplifting. So why that happens? Because it has that tonal stability. It reduces the cognitive load and enhances the autonomic stability. We spoke about the autonomic nervous system, that is the sympathetic and parasympathetic system. And because of that tonal stability, it enhances the autonomic stability, and that's how it has that effect, that raga rasa effect. However, rigid claims that this raga cures this disease are to be avoided, and we will discuss this in a little more detail later. The tala provides the cyclic rhythmic scaffold for gait training, for motor retraining, and for respiratory pacing. A person with a very fast breath rate, we can use the tala to reduce the breath rate. a person with a very slow breath rate, we can use the increased tempo to increase the breath rate. So external rhythm can be using any kind of percussion instrument or even simple taps or a metronome can be used to entrain the internal motor priming networks. So rhythm compensates for the uh, impairment in the internal time. The tanpura or the drone, even the harmonium or the simple digital shruti box, what it does, it creates that harmonic grounding and it supports the synchronization of the breath and reduces the sympathetic arousal. So in the ICU setting, just the tanpura drone can stabilize the respiratory rhythm. Now swaras can be used for melodic intonation therapy which we use for speech therapy in aphasia. So we can use the sa re ga pattern, sa re ga, sa re ga re, sa re sa. It takes a long time in aphasia patients, but the swara patterns, vocalizing the swaras will improve the breath control and they can also be used for voice therapy and speech rehabilitation. So we can use melody using swaras. It can recruit, in aphasia what happens, it's the left brain that is affected. So we can recruit the right hemisphere networks to aid the speech therapy. We can use devotional music in palliative care, bhajans, because they help existential anchoring. So this devotional music provides meaning beyond spiritual relief. It's not just about religious expression. It is affirming identity. Now, for dementia, we can also use folk music. We were talking about Indian classical music. What about the Indian folk music? What about the Indian film music? Regional folk songs, which we have heard in our childhood, which the client has heard in the childhood, can restore the cultural belonging and restore the memories of the childhood. And familiar songs can evoke the autobiographical memory. Whenever we have a song that we are already familiar to, it enhances the neural synchrony. The neural activation is much more. So I think this I covered already, but Raga Rasa concept I already covered. We can use a slow alap for calming, and we need to understand that the response to a raga is very personal. We can't give one raga for one particular disease. So the rigid prescription is something which we cannot use. This also I discussed. Now whether to use lyrics or whether to use instrumental music. Lyrics can be used for memory and meaning activation, whereas instrumental music reduce the cognitive load. So the selection of whether we need to use lyrical music or whether we need to use the instrumental music depends upon the patient's profile, the goal, the objective for which music therapy is being used. Which instrument to use? A lot of people ask me this question. I've given just an example. The instrument we use, the timbre of the instrument depends upon, the choice depends upon what physiological response we want. So when we give a particular drug, we can give it orally, we can give it intradermally, we can give it intravenously, we can give it intramuscularly, we can give it in several ways, right? So the choice of the instrument is like the mode of administration, the route of administration of a particular drug that we use. So if you use a basuri or a flute, it has that softness because it's a wind instrument. So the physiological response because of the soft music will be reduction in anxiety, it will be calming. The veena is is a string instrument. It can be used for resonance. It can be used for the grounding effect. The veena, similarly the sitar, any string instrument like santoor, tabla or mridangam, dholak, dholki, any rhythm percussion instrument can be used for rhythmic stimulation. Now, raga-based listening therapy is used to regulate mood, reduce anxiety, induce relaxation. Tala-guided rhythmic entrainment for improvement in gait, motor coordination, balance, in synchronization of breathing and respiratory therapy. Live instrumental music for calming the ICU patients, for pain relief, for creating a very healing environment. So, in such situations, we can use a soft basuri, veena, or sitar for calming the patient. For the motor rehabilitation, tabla or mridanga, you have to energize. Devotional music provides spiritual comfort and it enhances coping in the palliative and oncology care. So for that we can use bhajans, kirtans or abhangs. When we use culturally familiar folk songs, it evokes positive memories, it reduces loneliness and enhances social connection. So it is always wise to use songs, folk songs which are in the patient's own mother tongue. The activities that we can use are, one is call and response singing, which increases the patient engagement, improves communication skills and supports group cohesion. The Tanpura drone, harmonic bass, so continuous, so it is for relaxation, for mindfulness. Autonomic modulation and pain relief. When we discuss or sing an old film or a folk song, we discuss the lyrics. It stimulates memory in dementia, in palliative care. It encourages emotional experience. Using swaras, we can do what is called as melodic intonation therapy for aphasia. Also can be used for encouraging breath control. Just sustained swara singing. Sa. So breath control. Also for self-expression, for different combinations of swaras. Now our Indian lullabies, loris, can be used for calming the pediatric patients and even for anxious adults during procedures, and they can be used for sleep. So in the critical care setting, in the intensive care, music therapy can be used to reduce anxiety, stabilize breathing and heart rate, improve tolerance to the ventilation and promote sleep. They are mostly in the intensive care setting, they're all on ventilators. So in such situations, we can use live or recorded calming music interventions. In the oncology and palliative care, we can use songwriting, life review, relaxation, and this depends upon the patient's condition, for pain management and for emotional expression. So this also improves quality of life and spiritual well-being. We can do a bhajan session in the palliative care setting. In pediatrics, I already discussed, we can have interactive games, singing and instrumental play to reduce fear, reduce anxiety, and during injections, during chemotherapy, during any procedures. In the obstetric setting, it can be used for relief from labor pain and for bonding support. In the newborn, when the mother is feeding the baby, calming music in the background improves feeding. Lullabies improve sleep. We all know nothing can be better than the mother's voice to put the baby to sleep. It also improves oxygenation. So when oxygenation improves, the brain development improves for the babies. So in the neonatal setup, you can use lullabies, you can use live soft instruments. In neurology and in the rehabilitation settings, for post-stroke motor recovery, you can use rhythms, melodic intonation therapy for speech therapy in aphasia, cognitive stimulation in dementia and neurodegenerative disorders. In the mental health settings and psychiatry, to reduce agitation and depression, we can use music for calming, we can do songwriting, we can do improvisation and guided imagery. So when we use songwriting improvisation, it enhances coping mechanism to the mental health problem and also helps in expression, self-expression. So this is just a summary of whatever I said, just to reiterate whatever we discussed so far. Now let us move on to a few case studies, just 4 or 5 case studies, which is from our practice. So here is a 58-year-old male who had a middle cerebral artery stroke on the left side and he had expressive aphasia. So here our speech therapist, who is also a music therapist, did melodic intonation therapy using swaras and short lyrical phrases. Now this improved the fluency of this speech. So what started, the person could speak only 2 or 3 words. So we could help him improve the fluency. And because he was not able to express, the mind is working well, but he's not able to express, frustration also reduced. That was an added effect of the music therapy that we gave for the patient with middle cerebral stroke. Here is another story of a 42-year-old female who was undergoing chemotherapy for advanced breast cancer. She had significant anxiety. We used live music, Rag Yamad, with the Tanpura Dol constantly in play. We also used nostalgic film songs, and there was a reduction in the heart rate, which showed that the anxiety reduced, and the patient also said, I feel more relaxed, I feel more calm. In the pediatric ward, a 7-year-old boy with burns, severe burns, and who could not move his hands because of the burns, because of the injuries, the contracture due to the burns. He came from a village and was familiar only with folk songs. So we used Kannada folk songs, to which we asked him to try clapping his hands. Tapping also we tried. So what happened is, whether he moved his hand or not, using the song reduced the cry and it diverted his attention. And of course, slowly as the injuries healed, he also could engage in clapping along with us. In the geriatric ward, a 76-year-old woman with Alzheimer's disease and depression as well. We used bhajans and we used slow talas, the rhythms, and we used to clap, we used to use the patient's hand to tap and clap to our hand. So this, whenever they clapped with our hand, the eye contact of the patient with us improved, and we used familiar bhajans, so they spontaneously began to sing along. And what happened was, after a few weeks of therapy, the minute the person who was doing the music therapy landed in the ward, the person would automatically start singing a particular bhajan. This is about a 65-year-old male patient who had undergone cardiac bypass operation. Was in the recovery, and we gave live a flute in Raga Ahir Bhairav with breathing cues, and this helped in lowering the respiratory rate and improved the breathing comfort. So we talked about how assessment has to be done. We should also have a documentation pathway. What is the documentation that we need to do for music therapy? So we need to have the goals written clearly. So first thing will be the assessment summary. We talked about what should be assessed. So we need to have a summary of our assessment done. Then we need to write the goals, and then we need to document the session that we have done, the intervention that we have delivered, and what was the patient's response to the intervention and the outcome measurement. So always we need to do therapy only with the consent of the patient. Okay? So consent is again another part of the documentation. Without documentation, music therapy just becomes anecdotal. It will remain a story. It will remain a myth. So we need to have at least this much documentation. You should see our documentation. It goes even the assessment summary, and then the intervention, planning of the intervention, the design of the intervention, it runs in pages. So simple ways to measure outcomes depends upon for what purpose you use the music. If it was pain, we can use a simple pain scale such as the visual analog scale. We can use the anxiety scale, we can use mood scale, we can measure gait speed, stride length, cadence if you're using for motor rehabilitation. We have communication metrics like how, the fluency improved, what happened to the voice. So voice quality, we have got scales like the GRPAS scale or the Buffalo voice profile. So those kind of metrics we need to use to measure the outcomes. Always music therapy should be done with informed consent. We need to always be very clear about what falls within the professional role of a music therapist and what does not fall. So as I said, a music therapist conducts structured assessments, sets measurable goals, designs interventions for that particular individual. It is individualized intervention, documents the outcomes, and works with interdisciplinary teams, the treating team, the family, the nursing team, the physiotherapist, whoever, the interdisciplinary teams. But a music therapist is not meant for diagnosing the medical condition, should not alter the medications, should not provide psychotherapy beyond the scope of their training. If you're trained in psychotherapy, yes, you can integrate. But if you're not trained, do not do that. We should not promise cure based on the raga. So in simple terms, we should not make claims that exceed our training or that exceed the evidence based. And we should make it clear. A lot of people will ask you, what are you doing in the ward when you're calling it music therapy? I am not performing. I am not providing entertainment. It is not about just giving entertainment. I am not they will ask, are you singing bhajans? Are you chanting the Vedas? I am not prescribing religious solutions. The minute you say that I am giving Veda, I am giving mantra and all, you may be using it. But that is not what. You are choosing the Vedic mantra or the, the religious piece of music based on the client's preference. You are not spiritual leaders. Like, when we go to a particular priest or an astrologer, the astrologer will say you chant this mantra every day 12 times and this problem is solved. We are not that. We are not prescribing religious solutions. We are not substitutes for psychotherapy without training. We are not replacements for the medical doctor without the training. If you are a doctor, yes, you can do that. But that again depends upon which specialty you are. Like, I am an ENT surgeon, I can't start treating eye problems, right? I cannot start treating orthopedic problems. I can do music therapy, but I cannot do that. So we should not overclaim anything. So which raga to use for which problem or which condition? Is there a fixed raga condition combination? Yes, the scriptures have described these combinations. But what determines the raga combination, the raga to disease formula, it's not fixed. So what happens? How can we use the raga? How can we use the raga? What determines the effect of a raga? It is the elements, the musical elements. So traditional literature says specific ragas for a particular effect or particular emotional effect or a physiological effect. But clinical music therapy, it's not about one-to-one raga disease correspondence. The therapeutic impact of a raga depends not just on what raga it is or what is its scale structure, but on how it is rendered, how it is presented. It is the presentation which influences the physiological changes. So I just told you that we used Rag Yaman, we used Rag Ahir Bhairav. So if we take uh, uh, example that said Rag Yaman is good for anxiety, Ahir Bhairav is good for uh, calming. Uh, so the therapeutic effect of Rag Yaman or Rag Ahir Bhairav depends upon how the raga is presented, not just on the name of the raga. So, a raga is a framework, it is not a fixed stimulus. The raga has a particular scale, it has an arohana and avarohana, it has characteristic phrases, and it has by itself, it has a particular potential to create a particular emotion. But the clinical effect of the raga depends upon the musical elements, the modifiable variables, that is the tempo, the arrangement of the notes, the phrasing, the ornamentation, the gamaks, the emphasis that is laid on each note, the tempo that we use, vilambit or drut, the rhythm and tala density, the pitch range, the pitch register, the dynamics and the modulation, the ornamentation, the gamakas and the mean, the choice of instrument with which the raga is played, whether we use lyrics along with the raga or whether we use only instrumental, and also the performer's interpretation. So, a slow, sustained alap in rag yaman on a flute, again, the training of the performer. If it is played by Pandit Hariprasad Chaurasia or Praveen Gorkhindi ji, it can be calming, or flute N. Ramani ji, it can be calming. But somebody like me who doesn't know any flute has just started to blow into a flute, can it be calming? Nothing will happen, or it may have a negative effect. So, if we use the same rag Yaman, which is fast, which is tan filled with energetic tabla, will not be calming. It will increase the arousal. So, we are not prescribing rag Yaman for anxiety. We are prescribing musical elements embedded within rag Yaman for anxiety. It has to have a slow tempo, it has to have low, sustained notes. There should be minimal percussive complexity. It should have a smooth melodic contour. But if we use it for motor activation, it should have a clear, predictable rhythm. There should be a strong emphasis on beat. So the same raga rendered in uh, with a particular lay will produce an entirely different physiological response. So the laya is what determines the physiological response. The medium matters. If we use lyrics, it will engage the language networks and it will also convey the lyrical meaning and may evoke personal memories. Instrumental music reduces the semantic load, so there will be absorption of the pure tones and it will be less cognitively demanding. So in aphasia, instrumental play may be preferable initially, but we want the person to speak, so singing will be. In palliative care, lyrical bhajans or lyrical music may provide meaning-centered comfort. So the clinical effect is not brought about just by the raga, but by the modifiable variables in the raga. So when we say rag yaman or rag ahir bhairav may support anxiety reduction and therefore can also help reduction in the blood pressure, we mean that the qualities within these ragas, the certain structural qualities within these ragas can facilitate the parasympathetic activation, but the clinical effect depends upon the presentation, the tempo, the timbre, the lyrics or no lyrics, the choice of instrument, the dynamics, and most importantly, the patient's preference. So, we use musical elements within the raga to influence the neurophysiology. So, the raga is like the canvas on which we draw a painting. The therapeutic effects depends upon these elements. The strokes of the brush determine the beauty of the painting. So the way we use these elements in that raga determine the clinical effect. So to summarize, music therapy is structured, goal-oriented, and patient-centered. Indian traditions offer deep emotional and spiritual resonance. Live music allows greater adaptability, and of course, it is very important that we work with an interdisciplinary team and not in silos. You cannot sit in the one corner, open a clinic and say, I'm a music therapist and come to me. Even if you do that, you will have to work with the team of treating healthcare professionals. Thank you very much for your patient listening.
थैंक यू मैम. बहुत थैंक्स देने से पहले मैं थोड़ा सा मैम को और थोड़ा तकलीफ देना चाहूंगी. अगर कोई किसी को क्वेश्चन पूछना है मैम को, उससे और कुछ जानना चाहते हैं, कोई मन में सशंकता है या कुछ प्रश्न है, तो आप बिल्कुल मैम से पूछ सकते हो. तो शॉर्ट में कोई अगर पूछना चाहे तो पूछ सकते हो.
Yes, I will be happy to.
पूछना है किसी को कुछ?
Yeah, just one question, ma'am. When you select musical pieces for the clinical treatment, how do you go about it? I mean, do you select from available audios, or do you actually know people whom you invite to record musical pieces for y'all, or what is the modus that you all adopt?
Okay. Well, I am trained in music. I'm a Carnatic vocalist. I also sing a lot of film songs. Yes, today I was very bad at singing because I'm recovering from a bad respiratory infection. I'm having a bad cough. But otherwise, yes, I myself am a musician. But and I do play a few instruments as well. But then, yes, I do tie up with my own students are there who are studying in our own institution, who play instruments, who are trained in music, and whenever we want, we prefer live music. We identify the best of our own students or friends who can play the music. We do uh, uh, take the help of professionals also at times, but when we take the help of professionals, we have to record it in a studio because it's not possible for us to take them to the wards.
Yeah. Yeah, thank you so much. I mean, this session was really wonderful.
Thank you so much. Any other questions?
Thank you for a wonderful session, ma'am. It was very informative. Every second was informative and insightful, ma'am. Even I am also with bad cough, so no queries. Very thankful for you.
Thank you so much.
Yeah.
If you if it's possible, we do frequently conduct workshops where we do live demonstrations of how we do the therapy. I will share the details with Dr. Indrayani Joshi. You can travel down to Bangalore. Our workshops are, of course, we did hybrid mode, but it's for a better experiential learning. It is always better to be there in person. Canada.
Yeah, thank you, ma'am. Thank you so much.
Thank you, ma'am.
Thank you.
Thank you so much, ma'am.
Yeah, it is already late.
हाँ यस, लेकिन लास्ट सेगमेंट में जाने का मन ही नहीं हो रहा, लेकिन कहते ना कि टाइम लिमिट्स होते हैं और फिर एक थोड़ा सा कुछ मिल जाए तो उसमें सेटिस्फेक्शन होना बहुत जरूरी होता है ताकि हम आगे और जो है ज्यादा मिलने की उम्मीद भी रख सकते हैं। तो इसलिए और कहते हैं ना कि धन्यवाद हर चीज का करना चाहिए, हम प्रकृति का भी करना चाहिए, ईश्वर का भी करना चाहिए, हमारे माता पिता का, और जो हमें ज्ञान देता है उस गुरुओं का भी धन्यवाद करते रहना चाहिए। धन्यवाद ये भी एक थेरेपी की तरह काम करता
सबसे ज्यादा ज्ञान तो हमको नाद ब्रह्म से मिलता है, नाद ब्रह्म
है। मिलता है, ओके।
वहीं से मिलता है।
मैम, मैं आपका बहुत तहे दिल से थैंक यू कहना चाहती हूँ, धन्यवाद कहना चाहती हूँ। अन्नमय और प्राणमय कोश तो हमने आज डिनर लंच लेके तो अन्नमय कोश और सांस लेके हमने प्राणमय कोश को तो शुद्ध कर लिया था। आज आपने हमारा ज्ञानमय कोश, विज्ञानमय कोश और आनंदमय कोश को भी परिपूर्ण कर दिया। तो मैं बहुत तहे दिल से आपका धन्यवाद कहना चाहती हूँ, और ऐसे ही हमें मार्गदर्शन मिलता रहे। कैवल्यनाथ वेलनेस सेंटर का भी मैं बहुत धन्यवाद कहना चाहती हूँ, इंद्रायणी मैम, प्राची मैम और सभी सदस्यों का, कि जिन्होंने इतना अच्छे से सुन लिया, शब्द और शब्द। मैम, आपने तो शब्द ही पूरा म्यूजिक है, एक एक शब्द, एक एक वर्ड, कहते हैं कि हर शब्द में संगीत होता है, हर वर्ण में संगीत होता है। तो आपका हर शब्द हमें संगीत की तरह, थेरेपी की तरह आज हमारे मन पे और हमारे शरीर पे आज काम हो गया पूरा, जो भी था। और म्यूजिक थेरेपी के माध्यम से ही हम हमारे समग्र स्वास्थ्य पर, कहते हैं कि म्यूजिक इज मेडिसिन ऑफ माइंड, नॉट ओनली माइंड बट होलिस्टिक हेल्थ पे म्यूजिक काम करता है। आज आपके माध्यम से हमें पता चला, तो मैं
माइंड, बॉडी एंड सोल।
यस यस यस, बॉडी एंड सोल। वही मैंने कहा कि आनंदमय कोश और विज्ञानमय कोश और ज्ञानमय कोश हमारे आज बहुत, मतलब एक रोम रोम पुलकित होना जो होता है ना, वो आज अनुभव हुआ। और थैंक यू फॉर योर वर्ड्स, थैंक यू। और क्या कहूँ मैं,
थैंक यू।
स्पीचलेस है।
आपका मुझे धन्यवाद देना है, मुझे आपने अवकाश दिया उसको। थैंक यू सो मच।
थैंक यू, थैंक यू एवरीवन। ऐसे ही ज्वाइन होते रहिए और हम एक साथ सारे आनंद की प्राप्ति करेंगे। थैंक यू।
थैंक यू। गुड नाइट एवरीवन।